Hello, I'm Dr. Nolan Hetz, CEO of GlobaLASEReach. For the last 30 years, I practiced gynecology and female, concentrating my practice on chronic pelvic and bladder pain. These two conditions cause pain and suffering in 29 million American women and 1.5 billion women worldwide. Still, today's treatments are very ineffective and cause lots of side effects. Most women undergo major surgeries that involve removing the ovaries, the uterus, and sometimes parts of the bladder, only to find that 40% of these women continue to have pain after surgery. These women have to go on either chronic opioids or suffer in silence. Well, in 2016, my career changed photon energy through the skin to treat chronic pain conditions. I decided to try this on my pelvic and bladder pain patients by carefully administering photon energy through the vaginal walls to get the energy closer to the diseases deep in the pelvis that we cannot surgically remove. I was shocked by the fact that I was able to put the majority of women into remission with 5 to 6 simple treatments. Today, I introduced the world's first vaginal photon delivery system with CO2 gas cooling. We will sell our patented Resalox therapy device to every hospital, gynecologist, urologist, and physical therapist on the planet. In addition, we will sell treatment packages to these healthcare providers for every woman who wishes to receive this revolutionary therapy. We are seeking an investor to jump on board with us to help carry this device through our clinical studies that will be starting this coming spring that will lead to commercialization at the end of 2023. I personally know that vaginal administered photon therapy will put the majority of women in remission, while my team at GlobaLASEreach knows that our innovative Resalox therapy system will change the treatment paradigm for chronic bladder pain and pelvic pain worldwide very soon. Thank you.
Wonderful. Thank you. Judges?
Can this be applied to any pain? Is the principle that you're delivering heat rather than cooling like some of the others before you?
Well, that's the misconceived nature of what people think about high intensity photon therapy. But this is a little different in the sense that we're using 2 wavelengths at high intensity, using a cooling to cool the tissues that drive more photons deeper into the tissues. There's something going on here because it is amazing what happens if I can drop a woman's pelvic pain or bladder pain within 5 minutes of treatment, and with 6 treatments, put her in remission for months. So there's no world literature yet that anybody's used photon therapy through the vagina to get this energy closer to these tissues, and it's not heat. There's something else going on than heat that treats pelvic or bladder pain. There's plenty of literature out there about using photon therapy over through the skin, okay? But it's misconceived. There's something going on here because something's happening when you're properly administering the right dose and cooling the tissues.
But does this have application to pain in other areas of the body or only in the pelvic region when delivered
Other areas of the body.
transvaginally?
This vaginal probe can be put on the skin and do the same treatment. But what's interesting is this will be the world's only therapy that we can dwell over a spot because we're cooling the surface of the skin that will allow us to drive higher intensity photons deep in the tissues that cause pain. So
how do you see this, what sized practice does a physician need to justify implementing this equipment?
Well, we will be charging a package of 1,900 6 treatment sessions. If that same person is sent to the physical therapist, which is the typical 12 treatments, they will spend $3,200. Okay, so they can still charge $3,000. We get $1,900. But the size of the practice, this could be in every hospital, every clinic.
So you're pricing it based on sessions delivered.
Right. Physical therapy departments, urologist departments, gynecologist departments, pain clinics.